we look at a model, and this model is what is known as what? Maternal mortality. Sorry. Yeah, I've spoken a lot about obstetrics, so almost everything I'm assigning it to maternal. It's just mortality in a general, okay? Just having to do with what? Death of patients, okay? So mortality prediction model, first of all, you're just trying to do this because you want to estimate the likelihood of death in a patient that are critical ill. Do you understand? So they brought the patient is so ill, and you just want to look at the likelihood. What are the possibilities of this patient recovering? What are the possibilities of this patient dying? Do you understand? So you do this for especially patients that are in what? Intensive care unit, because of course when they take you to the intensive care unit, your issue is almost what? Deteriorating. So it helps clinicians access what? Severity, and help you to now know the type of treatment that patient needs. So versions of this is we have different versions. The MPM 02 assess mortality risks at the time of admission. So the other ones 24 hours, 48 hours, 72 hours. That one is just trying to follow 2 days, 1 day, 3 day. What's the risks? Okay, and all of that. Then the MP03 is a more recent version calibrated to modern ICU data, improving accuracy and requiring fewer variables. Okay, so key parameters, so they use combination of what? A lot of things to be able to now what? See, or determine the likelihood of a patient recovering. So the age of the patient, the admission type, what actually caused the admission, is one of the factors I can use to determine the likelihood of a patient recovering. Also clinical status, okay, how is the patient looking like as at the time of always going to look at the patient and all. Then physiologic markers, then what are the interventions that have been given to the patient so far, and is the patient recovering or responding to the interventions? Do you understand? So all those things you are putting into consideration. So how it works: the clinician inputs the patient data into the calculator or the scoring tool. So each of these should have a scoring. I think we'll still do a video talking about how to score them. So the model uses logistic regressions to estimate the probability of that patient surviving from that condition. So the results will now help you, guide the type of decisions you are making and all of that. So applications, it can help you to stratify the risk, can help you to improve the quality. It can also help on research.